Welcome back into Talking Fitchburg. Joined today from Fitch-Rona EMS. It's our chief. That was a deputy chief. It's the chief. Patrick Anderson here with us, Fitch-Rona EMS. How you doing, sir?
I'm doing well. Yourself?
Well, trying not to screw up everything, but here we are.
All right, we're good.
Now,
We're good.
appreciate you jumping on. I know you're a very busy person, but we wanted to get caught up with you because we saw, and if people know this from watching the show, I'm kind of a public safety nerd, but I saw that we got our two new ambulances in finally after tiny, small wait, Patrick.
A little delay. Yeah, about 3.5 years. We ordered those ambulances about 3.5 years ago. It's just the systemic post. So normally I'll give you that little quick down and dirty, right? We have a fleet of 5 trucks. We buy a new truck every 2 years, and then it stays with us for about 10 years. So then we just kind of continue to rotate, don't hit that impact all at one time. So, yeah, 3.5 years ago, right, we would have replaced our last one in 2023. So ordered that in 2021, or late then 2022. Even then, right, just with supply chains and COVID changed the industry in the world. So that, and then kind of like everybody did, similar to what we did. What do you mean it's going to be that long? So we actually ordered a good thing on our part. We actually ordered two of them back in 2021, knowing we weren't going to get it in 2023. So it actually came in 2025, which was when we would have replaced another one. So though I say we did take delivery of two ambulances this year, one of those should have come 2 years ago. And the way things are budgeted, it's a fleet replacement cost. So there was no additional funds needed in there. It just played out like it normally did. But yes, they finally came.
So someone might ask, why do you need to replace ambulances? As I think that's something that, if you're looking at the cost of it, you're like, oh my gosh, fire trucks, ambulances, they cost a lot of money, but why do we replace them every 10 years? And I have a suspicion I know a little bit, but
Sure. So we've actually kind of found in pretty good practice, and I shouldn't say I didn't establish this, right? It came before me, and seems to what has worked out. This time around, kind of based on how they got ordered, it might stretch out to a little farther than 10 years, but we're going to play that by ear. As you can imagine, right, they're emergency vehicles. We keep them in pretty good condition. They get serviced regularly, washed regularly, but they are big trucks, right? They are big Ford F450s, F550s is what we currently have. The one we just actually took it to, the one it replaced in 2023 just went to auction this morning with about 147,000 miles on it. And that's actually not the truck with the lowest amount of miles on it. So you can actually imagine those, and that's all roughly city driving. So that is the same, especially up in interesting to see, right? We run more calls up in northern Fitchburg, than we run here in Verona, but they have about the same amount of miles on them, right? Because it's fewer calls down here, but farther miles and more miles up there, but more or less miles, but more trips. So they're just hard on, we're just hard on trucks. Those big diesel trucks, weren't meant to drive 4 miles, 5 miles, 4 miles, 5 miles, 4 miles, 5 miles. So what we have found out, right, is actually just, and we've even seen it over the last 2 years, extending that one truck 2 more years. The cost of repairs and replacements and just maintenance has started to creep up. So I actually think we've kind of hit that sweet spot. With that as well, as we purchased the truck, we actually replaced most of the big items inside, such as the cot, the loading mechanism for the cot, our cardiac monitors. So essentially, it's a 10-year process. Kind of most of those things have a lifespan of about, even the cots, they say 7 years, we get 10 out of them. So yeah, about every 10 years, you get a new truck and we use it and take care of it the best we can for another 10 years.
yeah, it's like I said, it's a lot of things, a lot of moving parts, with no pun intended with that truck. But I think,
Right.
even when you think of your at-home vehicle, to get 10 years out of a vehicle, it takes a lot of work to do so. And yeah, it's just there's a lot going there. To close the door on that, but also prove that the point that you're moving, the call volume continues to go up dramatically. And, certainly this year, the last 6 months, we've seen upticks in COVID early. Then all of a sudden we got hit with Nora. You got hit with influenza. Your normal
Yeah,
every winter. So call volume. Why, Patrick? Why is it going up so much?
I wish I knew. It's a lot of suspect. We're trying to figure out exactly why it is because as I'm even talking with the city councils, right, it's not the most cost effective to just all right, let's hire more people and put more ambulances on the road. How do we the fire service, the job we say the job of the fire service is to put themselves out of a job, right? Fire prevention and preventing fires is really important in the fire service. So how do we in the EMS world adopt that, right? How do we put ourselves out of business? How do we get out in that community and prevent us from having to get calls? So, would love to hit that nail in the head to figure out what it is. Largely what we suspect, right? It is growth. Our communities are growing. We've got, that is how many, two senior housing projects that are in the process in both municipalities. Um, did get asked a few years ago by a council member, like, is it truly just the aging population? I said, I can't hear, running those numbers, it's not strictly that our number of calls for an aging population has increased, but I can tell you the average age of the population of our district has increased over the last 10 years. So, it's still the same age group. We just have more of that aging, and that tends to be that population that calls, right? They've just got more health problems. Hitting what you just talked about here, right? Norovirus, influenza A, COVID is still out there. I don't want to say we treat it like an upper respiratory infection, but it's an upper respiratory infection, right? So it's kind of really a perfect storm this last month, kind of starting the tail end of December and January, and we're still seeing it this month. Yeah, we had a record number of calls last month. I pulled that number. It was 491. Coming close to that, the second to that's about 467. So and for us, that's pretty significant. And from that over January was actually about a 20% increase in our calls from just a year ago. So hopefully, right, the hope is that is starting to level off, right? It's winter. I can't recall where we were at with our infection rates last year, but that sickness, all three of those has just kind of run rampant in any population, right? That's both extremes, the old, the young, and anybody with underlying health problems, that hits them hard. So yeah, we had a record number of calls last month, and it's on track for it again this month. So yeah, we're needing at this point, what we need to do is throw more ambulances at them until we can figure out what the underlying problems are.
Do you, as far as like communicating with the hospitals and local health officials, like, do they work with you too to be like, hey, heads up, we're seeing more of this. I mean, obviously you're seeing it firsthand because somebody picks up the phone and calls 911 and you're there. But how behind the scenes, what does that look like for people that kind of understand as you guys are wrapping your head around?
Yeah.
Okay, we're going to be dealing with a lot of upper respiratory and GI issues, or we're going to
Yeah.
be dealing with a lot of falls because it's wintertime, and that's just what it is.
True. Yeah. One of the really good things to come out of COVID was the relationship with EMS providers and county public health. So that, we were so reliant on them how many years ago on what do we need to know? And that relationship has actually really continued. They're really very informative about this is what we are seeing out there. And really it's just more information, right? COVID, upper respiratory, influenza, norovirus, they're all communicable diseases, right? It's nothing new. We're just seeing them in bigger numbers than has previously been seen. So, like I end every conversation we always have here, right? Cover your mouth and wash your hands, right? That is the way. That is the best way to prevent disease. But they share that information. This is right. Excuse me. This is what we're seeing, and this is how you can protect yourself.
Yeah, no, it makes sense. I think it's cool to know, like behind the scenes. I mean, you're doing everything in your power to educate and share information, do what you can, on top of taking calls and keeping the workforce up too. And the workforce staying healthy too during this isn't always easy as well. I know that can be challenging at times. I know we saw even from the buses today that their staff is out, a bunch out. So it's been very interesting. But when you look at those numbers, you're like, ooh. It's a lot.
Sure did. And it actually went through, like I'm sure most people's workplaces did. It rolled through our workplace as well. And that's right. People who know, I want to say know better, but have access to gloves and masks and eye protection and hand washing. But we are just in such close, intimate contact, and the number of people who have these diseases, we can do our best to prevent it. But every once in a while, we just get sick, and
It
yeah,
happens, right? I
people
mean,
sick,
it
right?
definitely. It, he's a little choked up because he's dealing with it right now, right on the spot here. But that's all good. Finally, here as as we wrap up, so you can rest your voice and whatnot, for just overall health information and just keeping up with what's going on and make yourself aware of these things. What do you recommend to people, just no matter what age you are, about practicing the best health that you can, and then just staying up in it? Because I think there is an awareness piece. Like if a lot of people are sick, then maybe you step up your game a little bit, right?
Yeah. Well, good health practices every day, right, are going to do the best. And people get sick, but I'll echo what public health says, what the CDC says. Vaccinate. I just saw a thing earlier the week. We were just traveling down south, right, and the CDC was on there saying it's not too late to get your vaccinations. So vaccinate against influenza A, influenza B. Get that COVID vaccination. So vaccines. The other one is just is good prevention. So actually, like you said, washing hands, and even some of the one of the things again came from public health, which was really great information. Always a good reminder to us that like the norovirus, right? That GI symptoms, that vomiting, diarrhea issue. Somebody's going to work, right? That norovirus. This is one. It's actually a virus that's actually very difficult to kill. So it tends to be just our normal wipe down cleaner stuff. Actually, is not really all that effective against norovirus. So we actually do carry bleach wipes. It's a 5% bleach solution. We just carry it in a wipe. That's actually what we switched to very specifically for about the last month and a half here, because that actually is much more effective in killing norovirus than just usual our normal cleaners. So
Yeah.
yeah,
Well, I think that's good information, right? I mean, you're adjusting to, like best practices, right? And we don't always think of those small little things of like Norb. Again, that's a good example of bleaches. It's not fun to work with bleach, but at the end of
yeah,
the day, if you're trying to kill it and keep it away, yeesh.
yeah. And really, as most probably all of us in our life have had that bad experience with bleach on that favorite sweatshirt, right? It is a 5% solution. So it is a very small, it's not going to ruin things. It's not going to stain them, right? Test your fabrics first, right? But it is a very small concentration of bleach, that 5%, that truly kills almost everything, right? And you can go get, I don't even know what a bleach used to cost 99 cents. It's probably up to $2 now, but that is just the easiest, almost kills everything. Some contact time of somewhere, I think it's about 3 to 5 minutes. Make sure you keep it wet, wipe it down. That really kills most things. So it's cleaning surfaces, cleaning food. If you have anybody with that diarrhea, vomiting stuff, right? Making sure that we're washing our hands. Any contact with food, especially if you're a food service person working in close contact with people working in assisted living centers. It's easy for me to say don't go to work, but don't go to work, right? We make sure we clean everything in our ambulance because we don't want to be passing it back and forth between patients. But right, wash your hands, cover your mouth, like I'm trying to do here, and then yeah, make sure you clean surfaces and do your best to stay healthy.
All right, Patrick, appreciate picking your brain on this stuff, and I'm taking notes as we here too, because definitely want to keep the households as healthy as possible. But
You got those little kids.
certainly, yeah, kids bring home everything. But nevertheless, appreciate the time. If people want to learn more about staying up on the brand new ambulances, or just any questions or general safety information, they can follow you. And that's on their website, Fitch-Rona website, and social media accounts. They keep those up regularly.
Perfect.
All
Thank you,
right,
Jim.
appreciate the time, Patrick.
Yeah, you're welcome.